IVF में मैं अपना ट्रीटमेंट करा रही हूँ। इंजेक्शन बहुत पेनफुल थे।
IVF is already very emotionally intense, but for many women, the physical pain, the injections becomes the most difficult part.
In many IVF cycles, that women have to take around 50 to 80 injections. Sometimes they may have to take more also, depending on the situation. Actually, these injections, patients are scared because of the pain.
You know, women have a lot of apprehension before they start IVF because they've heard a lot that from other people that it's a very painful process. You have to undergo multiple injectable, and there are a lot of myths surrounding that.
Particularly when you take the injection, there is always the blood that is seen surrounding the site of the injection, and that is the bruises are seen, or rather pigmentation, I would say. That is very common.
Lot of injections are supposed to be given during this IVF treatment, and every day patient is taking 3-4 injections. Is quite painful and very much patient is very much emotionally, psychologically stressed during this treatment.
As doctors, we focus more on our success rate. Sometimes we forget that what is this experience is costing her.
Needle-free injection system is perhaps the best. Pain is almost negligible. I would say it is less than 10% or almost nil.
NFIS company is bringing a new mode of delivering this injection, which is a needle-free. So patient will not be having the prick of the needle while receiving the dose. And that is going to change the perception of the patient about the IVF cycle.
When the pain reduces, generally the anxiety will come down. When the anxiety comes lesser, then their entire IVF journey becomes smoother and healthier.
Needle-free injections perhaps would be a game changer. Why would anybody opt for a prick?
Less painful injections can be a better experience for the woman. They're more compliant regarding the injection, and regarding the outcome, till now we are happy about the outcome.
I thought that because it just uses the technique of pressure. So you don't really feel any pain, you just feel something touched you. So that that needle phobia goes away completely that the patient has. So my biggest takeaway was that if it is as effective as the needle injections, then definitely it could revolutionize the whole treatment, and we can completely take care of the fear factor of pain with IVF for the patient.
IVF is not just about the procedures, it's about the trust. When patients trust, she won't be hurt and her confidence changes.
Even you don't have to apply too much pressure on the skin. Just you have to touch the skin, and the force, the pressure will put the drug inside the subcutaneous tissue, and that is why it is almost a painless injections.
And that is going to change the patient scenario. That patient will not be undergoing this pain because of the injection.
IVF generally demands a lot of things from the woman's body. But if there is something like needle-free injection system, at least we can reduce the pain and they'll be more comfortable.
अब मैं बिना निडल इंजेक्शन्स लगवा रही हूँ, वो पेनफुल्स नहीं है और उससे कोई निशान नहीं हो रहे हैं और मुझे कोई दर्द नहीं हो रहा है। ये हमारे लिए बहुत अच्छी बात है कि मुझे दर्द नहीं है उस इंजेक्शन से।
If you look back almost last 8-9 years back, we were the first company to launch enoxaparin in a pen device, and the story started from my personal experience. My wife had a few miscarriages, and then those days I was in Bombay, and the doctor prescribed her to take enoxaparin, one injection every day for almost 180 days. And the pain of taking that injection, initially I used to give the injection, then she started taking herself. At that point of time I always thought, can I do something to reduce this pain? And I know there are many other patients who must be suffering with the same condition, and that's how the innovation came that let's launch this in a pen device, because which is again minimizes the pen and the self-administration becomes easier.
There is this system which is available, NFIS. I think that will be a discussion between couples, among patients and a woman. I'm sure that's going to be the future.
It's quite appreciable that they thought about this and introduced this before anyone else, which makes them a leader in the innovation into this step. But it's all in all, it's very good for the patients who need the treatment.
I really wish that more and more people should be open to adapting it, and we should aim to make it the standard, because we are relieving the patient of pain, and if multiple cycles are needed and she doesn't have the fear of injections, you are actually increasing her chances of eventually getting a live baby. So I think it's wonderful. It should become the standard.
So actually, I think it'll revolutionize the complete drug delivery system which exists. So I think it's fabulous.